So we have Miss Sondra Rothwell now. She is MG and stiff person syndrome advocate. You may have seen her around. She has been with the MG Holistic Society for a while, and we love her. But Sondra, take it away.
And we love you, Dawn. And I wish I had more questions. I will have some questions for you later. It has just been an outstanding day. We have learned a lot, and I thank you all. Dawn, thank you so very much for everything. Now I have a question for the people in the room. Has anyone ever experienced any muscle spasms throughout their lives? Let me see a show of hands of muscle spasms. I think that I want you all to imagine something. Imagine having muscle spasms so bad around your chest that you can't breathe. You can't breathe. You can't take a deep breath. Your back is arching. Your neck is now locked up. Well, that was me. One Sunday afternoon, those muscle spasms started kicking through my back, through my muscles. I'm trying to drive. I said, oh my God, there's something wrong here. This is not normal. Well, the nurse became the patient. I'm here to tell you all, it was the scariest and the most terrifying experience that I had ever had. I remember getting to that emergency room. I remember telling the nurse that was right there, and I told her, I need you, something's wrong with my body. I never had this experience before. So now, let me tell you, my name again is Sondra Rothwell. I am a registered nurse, and I was diagnosed with stiff person syndrome in 2009. And it's a rare autoimmune neurological disorder that causes progressive muscle stiffness and severe muscle spasms. I do think one person, and that is Celine Dion. Are you all familiar with her, that singer? Well, she finally brought this particular disorder to the awareness to most people in America, or most people around the world. She finally had to cancel her concert in Las Vegas, and it's because of this. But she brought the awareness to the people, and I thank her for that. Prior to that diagnosis, I'm looking cute. Now I did say it was 2009, right? I'm working out. Oh, let me tell you, I don't think she's here right now. I was the person who was swimming. I did have an afro. I'm swimming, I'm working out, I'm lifting weights. I'm trying to have Michelle Obama muscles. Yeah, y'all know what I'm talking about. I'm doing my thing. I did all of this until my body started fighting back. I'm like, what is going on with me? This is not supposed to be happening. So now I'm going to share my story with you all to tell you that not just as a patient, but as a nurse, learning to listen to the language of pain. Now I'm not going to tell you throughout all the workout, the swimming, that I wasn't having any spasms. Yeah, I was having some spasms. I'm like, oh, that don't feel right. This is not normal. But okay, I can explain this away because I'm working out. I'm swimming. I'm doing core work. So the muscle spasms that I was having, it's okay. That's all normal. I explained it away, y'all. I dismissed my own symptoms until I couldn't anymore. My body said, no, something's wrong. Something is wrong. I remember telling myself, though, all I need to do is drink a little more water. I just need some electrolytes, take a little bit more magnesium. I'm gonna be all right. No, it didn't work like that. My body didn't do it. That Sunday afternoon when I finally got to the hospital, driving, praying to God that please let me make it to the emergency room before my body gave out. I mean, I'm like this, y'all. I'm like this. Now, mind you, I'm in Cobb County. I'm surprised. I thank God that nobody stopped me because I could have had an accident. I really I wasn't in the best place to be in a car. I really wasn't. But I thank God, and it was through the grace of God that I got to that hospital. When I got to the front desk and I saw the nurse and I told her something's wrong with my body. I don't know what's wrong. And I looked her in her face and I said, I'm a nurse too. The compassion that that woman had for me, for just being a nurse, she heard me and she felt me. She said, I got you. Got me in the back, started, doing the evaluation, started on some IV medication to help calm the muscles down. About 7 or 8 hours later, finally, the muscles were relaxed. But let me tell you what happens at the end here. Now I have bruised ribs. I'm exhausted. My body was done. I still was thanking God though. I got to that hospital at my pivotal time. Finally got home. Oh, let me just let you know, they did discharge me. And they discharged me with anti-inflammatories, muscle relaxants. But nobody could tell me what just happened to my body. Nobody. Got home. Remember, I told you all I'm a registered nurse. I picked up that phone. I called a friend of mine who was a physician, and I told her exactly what happened to the T. She said, girl, you need to get to a neurologist as soon as you can. I said, I don't know one. I need you to tell me where to go. So she directed me to a neurologist. 2 weeks later, I got a chance to see her. I say 2 weeks, but I also told you I was diagnosed in 2009, and I know that things are not the same thing. When I saw the neurologist, the first thing I told her is that I am terrified and I am scared. I'm a Black woman, and I know how this system works. I needed you to hear me. I needed you to not judge me, because what I'm about to show you and tell you was the strangest thing I have ever experienced. So I showed her what I did, what happened to my body, how I twisted the muscles, and how much pain it was, and what the heck was going on with me. I'm looking like I'm doing all of this, and I'm wide awake, looking like I'm having a complete seizure, but I'm awake. It's not making any sense. This particular doctor looked at me. She said, I hear you, and I believe you. I'm not going to dismiss you. It did something to me for someone to hear me. And I will say this, she heard me, and she wasn't a woman who looked like me, but she had compassion. And I thank God for that too. She told me something that changed my life, I have to say. She said, everything that you said, I do believe I know what's wrong with you. And she said, you have a very rare autoimmune neurological disorder called stiff man syndrome. First of all, I heard the word rare, and I'm like, what? And so, who comes out the top is Snoopy, not Snoopy, what's his name? Charlie Brown's teacher got the wong all over the place. So I'm like, okay, now I got to pull myself back together, because she just said rare, and now she said stiff man. A stiff man, what in the heck? That doesn't make any sense. And here I am, a woman. I'm not understanding any of this. Well, now you all know that stiff man syndrome has now been called stiff person syndrome. So they become a neutral name. She told me that it was no cure. The only thing that she could do for me, that she could do, is to help manage my symptoms. And for that, I am very much thankful. They did start me on a low dose of Valium. And I'm thinking Valium, I'm thinking as a nurse, remember? I'm thinking of Valium, I can't work with Valium. I'm gonna be chilled and rest, and just chilled out for the rest of the day. I can't do anything with it. But it did change my life, and I do thank her for that. Now, I can't tell you all that I didn't still have spasms. I did still have spasms for a couple of years, or several years later. And I did have to adjust my dosage of my medication to help me just to have a good day. Also, a couple of years after that, I did go to visit my family members in Colorado. In Colorado, many of you all know that plant-based medication is used along with other alternative therapies. And I had a good time I'll just say that, during that week. And I did partake in cannabis. I'm not ashamed to say. But what I will tell you is that in about 7 days, I never took the Valium. I noticed something about my body, and that was my muscles feel pretty good. I'm feeling calm. I'm relaxed. I'm still walking. I'm still exercising. I'm doing all the things that I'm supposed to do. As soon as I got back home to Atlanta, I made an appointment. Remember, I told you I'm a nurse, so I know you can make appointments with doctors, not just because I'm sick, but because I want to go ahead and have a consultation. Yep, Dr. Lisa, consultation, exactly what I did. Told her what happened, exactly what happened. I'm a believer that you have to be honest with your care team. So I told her, yes, I had cannabis, whether I smoked it or whether I took it as an edible. She told me that she understood, she heard me, and she actually believed me. Thing is, guess what? There was nothing really she could do. It's not legal in the state of Georgia. The cannabis is not legal here. But it didn't mean that it didn't happen and that I did not get the relief that I said that I had. So that, for me, that was powerful to hear her believe me. Although there was nothing really she could do. I wish she could have, but it's okay. The biggest thing that I can honestly say is that I realized that I found what worked for me in these spasms. And that is definitely maintaining my Valium. I do still utilize cannabis responsibly. I do talk to my doctor to let them know and understand why I'm doing it. They understand that they're compassionate with me. I also will say this. Remember me telling you about the 2-weeker? I was one of these people, and I know for a fact that I was a miracle. I was able to have a diagnosis in about 3 weeks with stiff person syndrome. Most people with autoimmune diseases don't get diagnosed that quick, and definitely not that one. I was glad that that particular neurologist had actually seen stiff person, so she recognized when I went and showed her the actual description of what I was going through. That was a blessing for me. The thing that I really want to tell people is that you gotta know your body. You know your body better than anyone else. I told you early on, I was exercising, I was still dismissing me. I was dismissing my symptoms, thinking it was something else, and when it kept going, I didn't do enough. I just didn't do enough. I tell people today, know yourself. Nobody knows your body better than you. If there's a twitch for me now, I take my medication, I do what I need to do. You all need to continue. You find your physicians, find the referrals, talk to them, be honest with them. And for all of the healthcare professionals that may be in the room, listen to your patients. They have something to say. They may not know how to get it out. Help them with the communication of it. Help them bring the words out. If I didn't say, I look like I was having a seizure, but I'm just doing this, I could have been easily dismissed, easily, without a problem. But this particular doctor didn't do that, and I thank God for that. I really want our physicians out there and healthcare professionals to listen without judgment. No rushing. Stop rushing these people. And we recognize our medical system is different these days. They only have so many minutes. People, before you go to see these doctors, write it down. Talk to someone. Have an advocate on your side. And let them help you explain to them what you're experiencing. It is so important. I stand here today not just with a rare disease, but a person, a student of my own body. Now I know what to listen for. I get quiet. I will tell you prior, I used to always say, you know, I was doing all the right things. I'm getting the mindfulness, the deep breathing, but when your chest and the muscles are so tight and you can't take a deep breath, now what you gonna do? So now things are a little different for me. While I don't have a lot of the spasms anymore, and I'm doing pretty good, I must admit, I am mindful now. I do my deep breathing exercises. I move, the movement that someone mentioned. I do eat clean. Lisa, Dr. Lisa, yes, I did decrease my alcohol consumption. So things did change. Things did change. I do stand here today and tell you that I am better. I don't have as many spasms as I used to. And for that, I am so grateful. The thing that I want to impart to you all is that continue talking to your doctors. Be your own advocate. Please be your own advocate. If you don't know what to say, like I said, talk to other people, talk to your friends, talk to other professionals. Get the words that you need to use so you can help these physicians understand your experience. The journey man began with pain and fear, and it was fear. I told you again, I'm a nurse, and unfortunately, you know, I have a little bit more experience about certain things. So I was scared to death, thinking that things were going to change and that my life was going to change. It changed, but it also changed for the better. Now, I know the strongest people in the room. It's not them people getting up at 5:30 in the morning like I used to go swimming. It's not that person with that beautiful arm like that Michelle Obama or like Sondra Rothwell, I just say. But it's the people who have to get up every day who have these autoimmune diseases, and you do it every single day, even when your body is telling you no. So for you all, you want to give yourselves a hand. You all are doing things all are doing. And I thank you, and I thank you, Dawn, for letting me share my story. Stiff person syndrome is very rare, 1 out of 1 million. Trust me, I play that lottery. I haven't won yet. But 1 out of 1 million people are diagnosed with this. So it is very rare. I want to thank you all. And I hope you all have had a wonderful, wonderful summer. I know we don't have a lot of time for questions. Maybe next time, but thank you all very much.
Thank you.